After knockoff, go back to res. We're gonna eat. We're either too tired or we go back to study. I'm kidding. We go back to study.
What's the coolest thing that you've actually seen in radiography?
There was a coin enlarged in the throat.
Did you even know what radiography is? Well, in this video, I interviewed a second-year radiography student and we talked about a lot of things. We talked about what is radiography.
We are the eyes of medicine.
What is the difference between radiography and radiology? And in the end, he tries his best to make you fall in love with radiography. Watch out this video because it was a blast and it was amazing. See you in the video. Hi, Bopela. How are you?
I'm good. How are you, Tom?
I'm also good. So today I'm going to be interviewing you about your course, that is radiography. And the first question that I have for you today is, what is actually radiography? If you had to explain it to someone like who doesn't know what radiography is, what would you say?
So in essence, radiography is an art and a science, right? So what we do is that we use radiation in order to produce medical images for diagnosis, right? We are the eyes of medicine in the sense that diagnosis starts with us. For anything inside the body, in order for doctors or surgeons or whoever not to need an invasive operation before getting to a diagnosis, right? They need us in order to show them what's happening on the inside.
Okay, that's wonderful. I like what you said there about you guys being the eyes of medicine. And let me ask you, the eyes of medicine, why did you actually choose to be the eyes of medicine? Why did you choose radiography?
So, what led to this choice, actually, started in high school when my little brother had to get an x-ray, right? So, when he came back with the x-ray, I saw it and I was like, this is cool, right? So then I began studying with the mentality that I'm going to be a radiologist. Misconception. Radiography is not radiology. So,
what's kind of like the difference between radiography and radiology? Can you just give us the difference there?
All right, so radiology is basically a specialist of medicine, right? You go and study your medicine degree, and then after that, you go on to specialize interpretation of radiographs and all of that. Whereas radiography is basically the science and art of producing those radiographs, right? So I ended up going along with my passion. The love for the arts, and then here I am.
Okay. So if you continue with this story, after your little brother's incident, that's when you kind of started studying, and after you find out that, what I loved was actually radiography, not radiology, then you went on for radiology. So how has it been so far?
It has been a journey, to say the least. And second year is actually, it's the dream that you would expect. Saying I'm in medical school, like I am living that dream, right? What I want is getting to interact with patients, produce the radiographs that started it all. So yeah, it's been a great journey.
Okay. That's wonderful. And if you had to compare between first year and second year, which one would you say that is best?
I think I'm being biased, but second year. Because again, interacting with patients, the different, imaging that we do, it's actually, maybe I'm just rushing to be qualified, but I prefer or I love second year.
Okay, that's wonderful. I bet many people would choose second year also, because who wants to be studying only without seeing the things? But now I want to ask you that, what's the coolest thing that you've actually seen in radiography?
The coolest thing I've actually seen, well, this is going to paint me a little bit as towards the dark side, but it was, long story short, there was a coin enlarged in the throat. That's the long story short.
Coin. Oh. That's interesting. That's interesting. Okay, now let's move to the theory part. What's the most interesting thing that you've learned ever since you started studying radiography?
I would say it's image evaluation and interpretation. honestly, I didn't like the whole concept of it or understand why we're doing it, right? Because we are basically learning to do what the radiologist does to a certain degree, right? So I was like, why am I doing this? Why am I doing this? Why am I
Yeah.
doing this? Right? But then I got to understand that the love for the cause is only made stronger because of those things, right? I'm not gonna lie, ne? They still they're still hitting hard. Like they still hit hard.
Yeah.
I'm not really all the best at it, but I'm learning about it and learning to familiarize yourself with the pathologies and the different cases that present. It's interesting. Again, it may point me towards the dark side, but you gotta love interesting cases.
Yeah. You just gotta love interesting cases. And so, what is kind of like the least, maybe least, seriously, least favorite thing about your course?
The least favorite thing about my course, I can't say it's only my course. There might be other people who relate, but I would say it's the rotation. I would honestly prefer to learn on the job than have to come back and go to classes because we have clinical blocks and we have academic blocks. So it's a whole month of rotating between all of that. I would honestly love to learn on the job.
Not in class.
Not in
I think many people would relate. But now, okay, now can you please like take us through your day? What does your day look like as a second year radiography student? Like from the moment you wake up until the moment you go and lie and sleep again.
Mm. But that question now goes back to on which block.
Okay, the hospital one, the one where you go into see patients.
All right, so for that one, uh, wake up, do all the necessities that you need to do, eat, shower, pray, you know.
Mm.
Then obviously somehow, some way, I'm always late, so I'm always running to the hospital. Right. So clock in 7:30 around that time. Right. So clean up our stations. Basically, it's important infection control. Make sure you clean the entire room and you also disinfect the surfaces. Right. uh, I feel like it also builds to, you know, like your personal integrity and your love for what you're doing. It may seem like a chore that, we could give to other people, but
Yeah.
it kind of just adds value to the day. So from there, after cleaning and all of that, we would normally have our first meeting during the day as our classmates, and then after that, we're off to work. Different assignments. You're either in chest, you're either in theater, you're either in main, you're either wherever they're gonna place you, you're gonna be placed. But unfortunately for second year, we don't get placed in specialties like MRI, CT. Right? We're just limited to general radiographs, but it's radiographs of everything at this point. So that's the whole day. Knock off at 4. Right? That's if it's a normal shift.
And when did you start?
We started at 7:30. Don't worry, there is a lunch, there is a tea. It's just that sometimes I forgot to take the tea and end up extremely hungry at lunch.
Oh,
Yeah, I think I still have that, you know, first time hospital, experience.
honeymoon phase.
Exactly. But then, yeah,
So,
after knock off,
yeah.
go back to res, we're gonna eat. We're either too tired or we go back to study. I'm kidding. We go back to study. We don't have time. We don't have time, honestly speaking.
You can afford to not study, right? And what do you think are some misconceptions that people have about radiography?
That question almost made me stand up. All right. I don't think this is a misconception at this point, but radio,
Cool.
you get radio presenters, right?
Oh.
That's the first misconception. And again, I think this one is also being dealt with, right? But we are also not nurses,
Oh.
right? We are in no way nurses. They do an important job, or their own important job, and we do our very own important job. We are not the same thing. Misconception again is that we're radiologists.
Oh.
We are not.
Yeah, not.
The pay definitely says. but we are not. Mm, and I feel like this one gets people angry, but we are also not button pushers.
Button what?
Button pushers.
What's that?
Basically, if you ever were to visit the imaging department, the radiology department, right, what you would be experiencing is a radiographer pressing things on the keyboard there, setting whatever exposures, and then exposing by pressing a button, right? But there are a whole lot of considerations when it comes to actually producing a radiograph, right? It starts from the request form, asking the patient what is wrong with the person, because there are some things when doctors or whoever asks for a radiograph, they don't check all of these final things. So we have to check all of these things, like pregnancy, like medication, when we're using contrast, for example. So these kind of things have to be put into consideration, right, before we can even start to orientate the patient. Then after, we also have to look at things like the body habitus, what kind of body that they have, right? Because these things have to be set. These days, luckily, it's made easier because you can set the exposures automatically. Say if you have a larger built patient, you can adjust the exposures automatically. But then what happens when the image is not the way that the doctor wants or is not of good quality? People who say this is easy, it's all about pushing buttons. You would come here, you would change whatever you want to change, you would expose the patient to unnecessary radiation and come up with an image that is of terrible quality and cannot even be used to diagnose it. So, yeah, this is possibly.
Misconception.
Yes.
Okay. Sorry for the misconceptions. We're not radio people. And then now I want to ask you a controversial question. Do you think radiography is better than radiology?
Mm, let me say personally, yes, I am. I'm here after. I'm
That's what you
here.
chose.
I mean, it's what I chose. But honestly, I feel like it also kind of depends, right? Things like your family background, how quickly you need to get into the work environment also play a factor, right? And basically what you love also. Because you can go study to become a doctor and then after that specialize after that just to end up going back to that field. I'm not gonna create another misconception by pretending like I know fully what radiologists do,
Yeah.
but yeah,
Still think you're better.
I would still honestly prefer this. For me, it's a personal choice. I prefer this, and second year is just making it worse. I'm just falling in love with this because it also allows me to branch out, broadly. I feel like everyone has this opportunity, but you can branch out within your workspace. You can branch out into teaching. You can branch out into anything that's associated with it. It's either IT, it's either the engineering side. It depends what you eventually end up falling in love with. Yes. So if I end up falling in love with the engineering aspect or the machine aspect of radiography, then you might find me, pursuing that aspect.
What have you fallen in love with so far?
So far, uh, it's it. I'm not
Uh,
for the surgery. I'm not for the surgery, but I do love being in the room and kind of because there's this. Uh, let's say, let me give an example of aligning the bones back to place after there was a fracture or a key break or something like that, right? So the process would have to be, you know how it is. You hammer in the plates, the screws, you have to do everything right. But you can't necessarily see, right? If you wanted to perfectly see, what would you have to do? You would have to remove all the tissue that's in your way and then actually place in the the plates and the screws in all the right places. But you can't do that without long lasting damage.
yeah.
So kind of like being in there and being part of all of that, the missing, and they do miss sometimes. You do miss sometimes. So you, as a medicine student, if you ever do venture into, is it orthopedics?
Orthopedics, yeah.
Yes. If you ever
Orthopedics.
do venture into that, practice being precise. Practice your anatomy. But yeah, it is kind of fun being in that environment.
That's wonderful that you've told us there. And it's interesting, right? It's interesting because I'm also learning right now what I need to do if I go there. But now I want to ask you kind of like two questions. What was your, in second year, what was your most rewarding moment? Can you remember your most rewarding moment and your most humbling moment?
Most rewarding. Most rewarding, and you're asking this in March. Okay.
A lot can happen in 3 months.
A lot of struggles happened in 2 months, yes. But I'll come back to most rewarding. Let me start with most humbling. So, radiography in of itself is a field that is kind of underlooked, right? A lot of misconceptions, a lot of associations, a lot of happen, right? And especially in the institution itself. Um, Thankfully, we do have a progressive school council that is trying their best, and I especially credit uh, for my institution, Radiography Students Organization, right? They make sure that radiography students do have a voice within the department, and they are basically just pushing that we as radiographers actually kind of like put ourselves out there, right? Which is how I got to be involved in a lot of things, if you remember from last year. They kind of gave me the push, and there was a point where I had to be humbled, right? I was doing too much, overexpending myself, right? And I ended up losing the goal of why am I
Actually,
out there,
yeah.
right? I kind of lost it for a bit, and then my seniors had to kind of remind me with what am I? What am I doing here? What is the objective here? So yeah, you can get lost in the passion, right?
Yeah.
You just have to make sure. But rewarding, because I can't really give you a straight answer right now, I would have to say my classmates. They are almost impossible to deal with there, but we have this weird kind of love, right? So they are very supportive. They are just the best people, the best team to have, right? So I would give a shout out to my classmates.
Shout out classmates. So yeah, that's wonderful. And so now, someone maybe let's talk about someone who's in first year doing radiography first year. What would you give them? What motivation would you give them? You know, to prepare them for second year. Like, what do they have to do while they're in first year to kind of like prepare for what's coming in second year?
That is that is good. To the first years, the important thing is anatomy. Sounds weird, but it is. The important thing is knowing your anatomy,
Yeah.
right? You have to know your anatomy because, in as much as we don't really deal with everything that's in anatomy, right? But you can't produce the required image if you don't exactly know what's required from the anatomy, right? You have to know your anatomy and be sure about it. And I think going into second year, learning that you have to revise all of it and learn it to an even better degree than you knew in first year.
Yeah.
Because obviously in first year it was a year module. We had to learn everything, and the institution doesn't really let us do what you guys do in anatomy, right? We do everything that you do in anatomy, but we don't go as deep. It's more catered to us. So yeah, I would advise that they learn to love anatomy and that they practice radiographic anatomy, right? Learn to distinguish what's needed in radiography.
That's wonderful. I hope someone is motivated after hearing that. And
So
now let's talk about someone who's venturing, they want to do uh, radiographs. They're still in high school, maybe. Maybe they're still even in primary because some people dream while they're still young, right? And so someone who's wanting to do radiography. First of all, let's take them through radiography. We already told them what radiography is. Now, can you tell them how many years does it take to complete a radiography degree? And then after that, give them some motivation.
All right. So step by step. So if you're looking to do radiography, it's a 4-year course, and you graduate with an honors, right? So immediately after graduating, you would be looking to do your master's, yes. Right. So the time is reasonable. 4th year, you end up doing a lot of research while working, right? So you will love the fact that you do everything that there is to do in imaging, from dentistry to MRI to CT, like basically everything, right? The qualification to getting in, right? I would say don't look at the recommended APS scores. The recommended APS scores are there just to give you a guideline of you qualify to get into it, but how serious or how hard of a worker are you, to get what you want? Because these days, people are hard workers. They know what they want, they're getting into what they want, right? So don't slack when it comes to studying. Don't slack. You have to make sure that you study and always make sure that you have your goal in mind. Now, for encouragement to come to radiography, what can I say? It's a beautiful course. It's an art and science. There's a lot to fight about. There's a lot to argue about. But radiography in of itself is something that needs passion, which is why most people who end up going and staying in the course, those are people who are like very passionate about what radiography is. And I hope to embody their spirits, right? Because there's so much to do in radiography. In terms of growing it, especially, right? There's so much work that needs to be done, and I just hope that I don't fail the childhood me, right? I want to grow it, put my part, put my footprint, right, for the next generation.
That's wonderful. I hope someone is motivated after that. I think many people might even change their minds and want to do radiography. But now for the final thing, to keep it like brief, this is where you kind of like, how can you make someone fall in love with radiography? Like, what can you say to actually make someone fall in love with radiography?
What can I say to make someone fall in love with radiography? What's there not to like? Simple, difficult question, right? But I honestly feel like visit your nearest radiographer, your nearest radiology department, your nearest hospital. Ask about radiography. Actually, ask about the two, get the difference. And I'm telling you, just from being in the space and understanding what they do practically, right, will just help you understand what their role is, how important it is, and how wonderful of a course it is. Because it really is an amazing course. I just cannot. Just save me for the next.
That was wonderful, man. Thank you for like coming here and speaking with us about radiography. I learned a lot personally, and I hope those who are watching they also learned a lot. And we hope to have you next time when we do other series. But for now, we're gonna come to an end, and we thank you for being with us here today and sharing your insight and your knowledge and your experiences in radiography. So Upelo does a lot of things. Maybe before we end, you can talk about that, things that you do apart from radiography, more S.M.U.
All right. So for this year, I kind of had to start focusing more on academics. Remember the humbling experience, but
Yeah.
I am the radiography B-Rad liaison officer under the school council for Chairman Vumboni here at S.M.U. And again, I am the academics officer for the Radiography Students Organization, right? So I am basically developing myself in that aspect. And I'm also working to be an established face of IPCP. So, in conclusion, I want to say especially thank you for showcasing the spirit of interprofessional and collaborative practice. It really does mean a lot that you are taking the time to kind of like bring this information out to people and kind of like bridge the gap to where do we meet in the world, where do we meet when we're working.
Definitely. Thank you for the wonderful compliment. And that's what we are aiming to do. That's what we are pushing to do here. And now we've reached the end of this video. We hope you liked having Opfelo here. And his insights, his knowledge, his wisdom. We hope to see you in the next one. Make sure you comment, like, and subscribe and share with your friends. We'll see you in episode 3.